Well, hello everyone. My name's Nick Mullins. I'm with Activ Doctors Online. Welcome to our June webinar. As you all know, we've just entered summer, and no doubt all of us are going to be having a lot more fun in the sun over the next few months, which also brings up the topic of this month's webinar, skin cancer. Obviously, being out in the sun a lot more increases the risk of some people developing skin cancer. So in today's webinar, we're going to be looking at what exactly is skin cancer, the effects of skin cancer, the risk factors of skin cancer, and what you can do to lower your risk of developing skin cancer. We've got our expert on all medical issues, Dr. Howard Zahalsky, who will be taking us through today's webinar and telling us all about skin cancer. So with that, I'll hand it over to you, Dr. Zahalsky.
So thank you very much, Nick. So today we're going to talk about skin cancer, and we're going to start with some of the risk factors. Why does someone get skin cancer? And there are two main reasons why people get skin cancer. They are the sun and genetics. Some people get a lot more sun than others. For instance, our Activ Doctors headquarters located in Florida. So we're going to see a lot more sun down there and a lot more bright sun down there than if you lived in, let's say, northern Canada. This is a good example of someone who's gotten a little bit too much sun. Now, this person has actually tried, as you can see kind of from his shoulder blades. This is probably someone who tried to put on a little sunscreen by themselves, but really needed someone else to help them get the middle of their back. Having a bad sunburn, at least one ugly, blistering sunburn in your life, significantly increases your risk of getting skin cancer at some point in your life. Now, genetics play a major role as well. If you are from, let's say, Northern European descent, and you move to Florida, you're going to be at much higher risk of getting skin cancer because you have a paler complexion. People with red hair, people with freckles are much more at risk of skin cancer than someone with a darker Mediterranean complexion or African American darker complexion. You're going to be at much less risk of skin cancer. Now, we're going to go on to the next slide in a minute, but first I want to give fair warning. We are going to be showing some skin lesions. I've tried to pick slides that are medical and show as little, what we'll say, disgusting stuff as possible, but if you're watching this over lunch, there may be one or two slides that make you feel a little bit uncomfortable. All right, let's go on to the next slide. So we're going to start with this lesion. This is what's known as a basal cell carcinoma. It is a skin cancer, but it's about as uncancerous as you can get. First, how would we identify this as a skin cancer? Well, a basal cell carcinoma, which is actually the most common type of skin cancer, has kind of a pearl. You can see this kind of looks like mother of pearl complexion to it, kind of a little shiny, a little bit waxy. The other thing is you can see blood vessels in it. You can see a couple of darker stripes, kind of almost gives it a baseball look to it. Those are blood vessels running through it. This is a classic basal cell carcinoma. Now, the good thing about basal cell carcinoma is they never metastasize. Metastasize is when a cancer breaks off and flies to other places like your lungs or your liver. That's how most cancers end up killing you. Basal cell carcinomas never metastasize, but what they do is they progressively get bigger and bigger and bigger. And because they don't really look that dangerous, people can ignore them for large periods of time. By the time they get bigger, it can take a lot of surgery to actually cut it out because these, like many skin cancer, like to send roots underneath them so that if you just cut out just the lesion, just the bump that you're seeing, the basal cell carcinoma is likely to come back. So you actually need to take a fair amount of skin beyond what you see there. And if you let it get big, then you're going to need to take a very large area of skin to make sure that you get the whole thing. But by and large, basal cell carcinomas never kill anybody. Let's go on to our next picture. So this is a squamous cell carcinoma. The big difference between this and the basal cell when it comes to looking at it is that it ulcerates. You can see it looks like someone's taken a bite out of the middle of it. That's what makes it much more likely to be a squamous cell carcinoma. These are cancers that are typically found more commonly in the head and neck region. They certainly are at a higher frequency in areas that get sunburned, but any area of chronic skin irritation can result in a squamous cell carcinoma. For instance, areas that frequently get rubbed. If you are prone to biting your cheek, the inside of your cheek is going to be at slightly higher risk of getting squamous cell carcinoma of your cheek. One area that you can thank me later, chose not to include a picture of is it is possible to get squamous cell carcinoma of the male genitalia of the penis, particularly if you are uncircumcised, because the foreskin can get chronically irritated, and that can lead to squamous cell carcinoma of the penis, and we call that Bowen's disease. Squamous cell carcinoma is a bit more dangerous than basal cell carcinoma. Squamous cell carcinoma can spread beyond the area of the lesion itself and can go to lymph nodes and other parts of your body, but it usually takes quite a while. And because these lesions do tend to look a little uglier than basal cell carcinomas, they usually are brought to medical attention long before they have spread anywhere. And again, while you do have to take quite a bit of skin around the lesion to get the whole thing, most of the time just cutting it out is sufficient. Let's go on to the next slide. So here are 4 pictures of what everyone really worries about when you're talking about skin cancer. Malignant melanoma. There are multiple ways to identify a melanoma, multiple things that melanomas do that are unlike other skin cancers. First of all, they don't usually ulcerate. And unlike either basal or squamous cell, they don't usually get too raised off the skin. They can get a little bit bumpy, but not usually too much. But they do kind of spread outward like a stain. Now, things to look for when you're looking at melanoma, you can see on the far left asymmetry. An area of the splotch is darker than the others. Border irregularity. It's not going to be a nice, even, round lesion, like even the basal and squamous cell carcinomas are, but it's going to be lumpy and more like an island. The color. There's going to be variations in the color and also the color at the edges. The first 2 pictures, the asymmetry and the border irregularity pictures, they don't really show this as well as I would like, but this one really shows it. You can't always tell where the splotch ends and where normal skin begins. Even in the first 2 pictures, if I gave you a marker, you could probably pretty clearly draw it around the lesion. In this, especially on the right side of the splotch under color, there's an area where it just seems to fade out. That's very characteristic of a melanoma. And then the last thing is diameter. More than a 1/4 inch across or 6 millimeters across is more likely to be a melanoma. These are very, very dangerous lesions. And so if you do have a history of bad sunburns, if you are fair-skinned and live in a sunny area, getting checked over your skin by at least a regular doctor and maybe a dermatologist on a regular basis for these can be very important because they spread very quickly. If you have a melanoma and it gets more than 4 millimeters, that's about a 1/4 inch deep, it is almost guaranteed to have spread to other parts of your body. And when it goes there, it can go fast. Melanoma likes to go to your lungs. It even likes to go to your brain. And there are very poor treatments once melanoma has spread. So catching it early is very, very important. Unfortunately, melanoma can hit some very strange places. I know we talked about Bowen's disease with squamous cell carcinoma, but melanoma likes to hide in some really strange places that can make it hard to find before it's too late. And I'm going to show some of these on the next slide. This is what's called subungual melanoma, also known as melanoma underneath the nail. It will start as what looks like a bruise underneath the nail, just a dark area underneath the nail. You'll think that you probably hit your finger on something. but then over time it will get bigger, it may bulge out slightly, and can even cause your nail to fall off. By the time you have this, a melanoma this big, unfortunately it's likely that it started to spread elsewhere. Fortunately, melanoma under the nail is fairly rare. Let's go on to the next slide. What you're looking at here is melanoma of your retina. Your retina is exposed to sun. This is the back of your eye. All the light that you see is going into your eye and hitting the back of your eye, which helps you to see. So over time, you can develop a small blind spot. You probably won't even notice it at first, but after a while, you'll say, whenever I try and look to the right, I'm not seeing as well. And you go to the eye doctor, and they'll look, and they can find this, a melanoma at the back of your eye. This actually requires complete removal of the eye. Obviously devastating, but fortunately, it is one of the slower melanomas to spread to other places. So most of the time, when you do find a melanoma of the eye, excision of the eye can be curative. Let's go on to the next slide. All right, so although this looks really ugly, a guy with a red, crusty head, this is my first slide, which is an example of things that look bad, but it turns out aren't skin cancer, because as much as it is important to understand what is skin cancer, it's important to be able to look at lesions and know what isn't skin cancer. These are what's known as actinic keratoses. Actinic keratoses are actually dangerous. They are pre-malignant lesions, and if left alone for usually several years, they have a tendency to become squamous cell carcinomas. Actinic keratoses such as this are most common actually on the scalp of bald men, although they can form on ears, on the face, on the shoulders as well. They're basically known, you can basically tell if you have an actinic keratosis because the skin around the area is red, but it feels like there's a scab. Although it won't look dark like a scab, it usually feels white and flaky and hard, and you can see areas here that kind of have a whitish, greenish, they're usually not greenish, it's mostly the photography in this picture, a whitish kind of crust on the top that you feel like you just want to pick off. But even if you do pick it off, usually you're left with a little sore there, and the crust, the white crust will grow back. And again, that's an actinic keratosis. If they are left alone, they will turn into cancer, and usually you just get one or two of them at a time. The treatment by a dermatologist is usually to burn them off with liquid nitrogen, and that will usually solve the entire problem and prevent them from becoming skin cancer. However, when you have a gentleman like this who has a whole plethora of them over the course of the scalp, there are liquid shampoos. One is called 5-FU. It stands for 5-fluorouracil. It's basically chemotherapy like you would give for cancer, but in a topical shampoo. And you put that on every day for a few weeks, and it will basically destroy all the actinic keratoses. It will usually leave you with a bit of an ugly rash on your scalp for a couple of weeks too, but it's better than trying to freeze all of these lesions one at a time. On the next slide, we'll see another thing that sometimes gets people worry about might be skin cancer. These are what's called seborrheic keratoses. These are completely not dangerous. They obviously look big and somewhat angry and very crusty, and sometimes people mistake them for melanoma. The thing is, they get really, really large, much larger than a melanoma would ever get. And again, they actually look like a scab, like something that you could pick off. But even if you pick them off, they will come back. They never turn into skin cancer. You can tell their difference from melanoma, again, because they have very sharp borders. You can certainly tell where they end and the regular skin begins. And especially like the one in the upper left side of the screen, they're usually fairly circular or oval and don't have very irregular borders, even though on the one in the bottom right, the color seems to be quite variable. But if anything, it looks kind of like a tortoise shell. You're not going to worry that these are going to turn into cancer. Other than getting bigger, they never do anything dangerous to you. the biggest problem with them is that they're just aesthetically displeasing. They look ugly. So let's go on to the next slide. This is an example of an older person who has many, many seborrheic keratoses. I see a lot of people like this all of the time. And do you know what we do about this? Nothing. There is absolutely nothing to worry about with all of these seborrheic keratoses. But you can see that they can be lighter or darker, but their sharp borders and their crustiness differentiate them from melanoma. On the next slide, we're going to see a mole, a plain average mole. This is what people come to me the most with, worrying that they're going to be melanoma. But let's look at it. We can be pretty sure that this is not, in fact, a melanoma. It is pretty much one color. It's almost a complete circle. You can certainly tell where it ends and the normal skin begins. It's a little bit lumpy. It is dark. This one I chose intentionally because it is very dark, to make the point that a dark mole can still be a very benign mole. This is a mole that you might keep an eye on and see if it starts to grow, but this does not at all look like melanoma or cancer. And if I saw this in the office, I would reassure the patient that they do not have a dangerous skin lesion. Next slide. So here we have one of the most common skin lesions that I see, which is hemangiomas, also known as cherry hemangiomas. People worry about these a lot, and you can get many, many of these on your skin. It's said that excessive alcohol also makes you more susceptible to these. They look like little red blisters, and sometimes when they start, people think they're getting a bad rash or chiggers, which is common in Florida. No, these are just totally benign skin lesions that are caused by basically blood vessels that get too near the skin getting stretched out a little bit. They're basically the varicose veins of the artery system. The arteries are the vessels that bring the blood away from the heart, and the veins are the blood vessels that bring the blood back to the heart. When you have a stretched out vein, we call it a varicose vein. When you have a stretched out artery, we call it a hemangioma. And these are benign hemangiomas that, if I saw in the office, you would do absolutely nothing about. It's hard to treat them. You can treat them with liquid nitrogen, but again, most of these come on in clusters, and so it can be very hard to treat all of them. So what do we do to make sure that you get as few skin lesions as possible, both benign and dangerous malignant skin cancers? And the first answer is actually very simple. And we'll go on to the next slide. Sunscreen. The best thing you could do to protect yourself from skin damage, wrinkles, regular moles, actinic keratoses, and even the dangerous skin cancer is sunscreen. It's not good enough to apply it once in the morning and be done with it, especially if you're going swimming where the water can wash it off. Even those that say water resistant, they are, or waterproof. If you read the bottle carefully, they say, well, yeah, waterproof, but you should still probably reapply every 30 minutes to an hour if you're in the water. Even the wind at the beach, the wind blowing sand around, that's knocking off all the sunscreen off your skin. So I recommend reapplying sunscreen liberally throughout the day, especially if you're in the sun. I even recommend sun shirts. When I was a child, no one wore sun shirts. That was only for the fat kids who didn't want to show their bellies on the beach. Now everyone's wearing sun shirts. I strongly recommend those. They're even better than sunscreen at preventing skin damage and ultraviolet radiation damage to your skin. On the next slide, my final picture slide of the day, I have an example of just how much skin needs to be cut away when you're taking a malignant melanoma off. Even more than the squamous and basal cell, because the risk of spread of melanoma is so high, you have to take large areas of skin. This is an example of somebody who had a melanoma resected that was probably no more than a half an inch across, but you can see that the area of skin they needed to cut away and then put a flap over was probably 8 to 10 inches across to make sure that they got it all. So you can put on the sunscreen now, and you might not have that beautiful tan that you were hoping for, or you can end up with a scar like this later, which is much less pretty than a lousy tan. So on to the next slide. How can Activ Doctors Online work for you, specifically with regard to skin cancer? Well, with our personal health records, you have your easy, secure, and available health record that can be found 24 hours a day, 7 days a week from anywhere, any country, any doctor's office. A lot of my patients, especially ones who have a lot of moles and might be seeing the dermatologist likes to take pictures of individual moles so that they can follow them. Now, what happens if you move to another city? All of a sudden, you've lost all of those pictures, and getting them from your old doctor can be very difficult. With our PHR, you can save all of those pictures onto your own personal health record so that your pictures of your moles can go with you whenever you do. If you have a complicated situation, let's say your doctor thinks you have a dangerous mole or skin cancer, you can use our online second medical opinion to send those records, those pictures, to one of our specialists who can look at it and give their recommendations. And finally, with our e-consult, if your doctor participates, maybe you can even show your doctor a mole online and say, hey, does this look dangerous, without having to make the long trip to the doctor's office and wait in the waiting room for 30 minutes just so that he can look at a mole that turns out to be nothing. So for all these reasons, starting a free trial with Activ Doctors Online may be just the thing that your skin is asking for. With that, I'm going to turn it back over to Nick.
Thank you, Dr. Zahalsky, for another great webinar. We really enjoyed that. At Activ Doctors Online, our vision is to educate, engage, and empower our members to take control of their health and really get them involved by providing that sort of easy accessibility to their health information and easy accessibility to doctors anywhere, anytime. If you would like to try Activ Doctors Online for free, you can do so by heading on over to activdoctorsonline.com, where you can sign up and have a free 30-day trial and get access to all our great services. If you would like to see how the platform works or have any questions or anything, you can contact myself or Dr. Zahalsky at the emails provided on the screen and request that. And don't forget to follow us on all the social media platforms. We also upload all our videos to our YouTube and Vimeo channels once they conclude. And with that, I want to say thank you for tuning in, and we'll see you next time.